So I want to now think a bit about sort of some of the principles that lie behind when trying to treat patients of this sort. One thing I think is certain is that the psychotic patient is very highly sensitized to the emotional state of the therapist. A patient I saw after she'd had a breakdown once said to me after she'd come in, "I'm not going to start till you've got that off your mind." So she could tell, that was something on my mind, and she wouldn't start until I'd sort of disposed of it, as it were. And in fact, I think one of the reasons sometimes for the very severe disturbance of people like this is that the individual is more affected by the states of mind of others around them than, say, people who are, quotes, more normal. Therefore, the emotional state of mind, I think, of the therapist is the crucial factor. What you say to the patient comes second. And if you think of the sort of ways in which we often listen to clinical presentations and that, there's much more emphasis on what's said and what's said back and forth, whereas the real communication is lying between the inner state of mind of the therapist and the inner state of mind of the patient. And that's why I said over the thing that if you say something that's you've really ingested as a therapist, and it's perhaps something a supervisor said or something that you've read, and it's not truly has been sort of created as something personal inside of yourself, it has no effect. And in fact only adds to the problem of patients of this sort who are already overloaded with what one might call injunctions and commands from within. So also the way someone relates to himself and his world correlates with the way he or she communicates. When the communication changes between the patient and the therapist, so also the behavioral mode of functioning changes, the external appearance. I'll just give you one little example. A man complained bitterly about his father, and that his father had no job and had no interest in life, and he seemed to be in the same mode. And he seemed, my own sort of feeling about him was that he was odd and peculiar, and his appearance was tall, lanky, with red hair, and somehow that preoccupied me more than anything else. Then in one session, as I was talking, I had a surprising internal change. I suddenly thought, "I like you," I said to myself. And somehow the outer appearance of sort of oddity dissolved in my mind. I found I liked him, and I was surprised by it. I didn't say anything about this, but I felt fairly certain that this change in me would show up in his behavior. I felt this sort of certainty from previous experiences of a similar nature. The next session, he told me that he'd been offered to direct a series of programs on Venetian painters by one of the TV companies. So that's just to illustrate, really, that sort of inner attitude led to a change. Freud, in fact, does say on a couple of occasions that there is an inner communication between the analyst and the patient, or the therapist and the patient. I can just give you those. Freud says, "I have good reason for asserting that everyone possesses in his own unconscious an instrument with which he can interpret the utterances of the unconscious of other people." He also says, "It's a very remarkable thing that the unconscious of one human being can react upon that of another without passing through consciousness." And I feel absolutely certain of that, because sometimes when supervising someone has said, "Oh, I thought this, but I didn't say anything about it," then it's quite clear from what emerges, that the patient had responded to that inner thought. So that's the first thing about the inner state of the inner state of mind of the therapist. The next thing is, I think, healing comes about through being known. But it's not through being known that you've sort of learnt a particular theory, but you've come to know something through the sort of relation with the patient. The Christian existentialist philosopher Paul Tillich says this, which I think expresses exactly what I'm trying to say. He says, truths, once deep and powerful, discovered by the greatest geniuses through profound suffering, incredible labor, become shallow and superficial when used in daily discussion. How can and how does this tragedy occur? It can and does unavoidably occur because there can be no depth without the way to the depth. The truth without the way to the truth is dead. If it is still used, it contributes only to the surface of things. And so it's like any of the sort of great clinicians like Freud or Melanie Klein or Kohut or Bion or Winnicott, if you just sort of pick up the end point, like the true and the false self, or the concept of resistance, or the concept of projective identification, it is really dead unless you can enter into the journey by which the person arrived at that. And really, unless you yourself arrive at it with a sort of sudden burst of understanding, it's not effective with patients of this sort. It's a bit a question of what I call looking and just staying with the chaos until some type of a pattern begins to emerge. The French painter André Lotte, who wrote about and followed to quite an extent Cézanne, he says this, but I think it expresses again what I'm trying to say. He says, for centuries, the cultured Frenchman has been taught that order ought to precede the organization of forms and colors, but not that passion, when it is unleashed in the transports of consciousness, may seek to base itself on a new order, ceaselessly invented, which will be nothing but the fixation of rhythm or even of its explosion. The Latin mentality doesn't appreciate this organization sought in the heart of cataclysm. It needs the whole time a priori instructions, nice clean cages to imprison the birds of its imagination. It doesn't easily discern these unstable architectures, always renewed, which inspiration builds by trial and error. So he's saying that, coming to see it and arrive at it, rather than imposing something from a sort of predisposed sort of idea. What for me is remarkable about Agatha in the way that she proceeded with Bernadette is that she was on a journey of discovery. And it's not just intellectual discovery, it was a journey of emotional discovery also. What she learned, she really had learned herself. And it's in this manner of knowing that is essential for the therapy of psychotic patients. This is why I've come to think in recent times it's a mistake, I think, in psychotherapy training programs to be teaching Freud, Klein, Winnicott, Bion or Kohut. Students need to be reaching their own truth, and it was quite, I think, significant that Agatha reached her own truth without a great deal of type of training and learning about these different theorists.